All right, well, we'll go ahead and get started, and I will just let people in as they come. Thank you guys for joining us for our May Family First Wednesday. It's actually on the first this month, so it's kind of cool. We have Yellowstone Boys and Girls Ranch here to talk to us about their community-based services. Before we get into that, I wanted to remind everybody that our family membership is free through Montana's network, and we will be forming a Facebook group for those members to kind of connect in a community. And then the Billings area began 2 new support groups. So if anybody is in the area and is interested, let me know and I'll send you the info. So today we have Alexis with us. She is the Administrative Supervisor of Community-Based Services and Outpatient Services for Yellowstone Boys and Girls Ranch. And so I will turn it over to you.
Perfect, thank you. I'm gonna share my screen here. All right. And then let me jump into our PowerPoint. Perfect. So again, my name is Alexis Friedenfeld. I am the Administrative Supervisor of Community-Based Services, one of 7 of the administrative supervisors that oversees our services throughout Montana. I also am an outpatient therapist with YBGR as well. Everybody can see the screen. I'm good to go to move forward from there. Perfect. Awesome. So today I'm going to share a little bit about mainly our community-based services, and then I'll kind of touch a little bit on some of the other services that YBGR is currently providing. I'll give a little bit of a blurb about kind of what they are, each of the different services and kind of where we're located. And then at the end, I would be more than happy to answer any questions specifically about a program or what YBGR is doing. So in our community-based services, this is kind of the menu of services that we're providing right now. We have our school-based services, which is often referred to as our CSCT programs. We have our targeted case management, our therapeutic youth mentoring, home support services, an employment support program. We do visit coaching and parenting classes, outpatient therapy, and some chemical dependency in our contracted counties that we're working with the state on. And then a little bit about some other services that are being provided through YBGR that we won't maybe get into as much is we have our day treatment program, Yellowstone Academy, that's located on our physical ranch in Billings. And that's working with kiddos who are on our residential facility, as well as kids that are referred by their home district into that day treatment program. And then we have our psychiatric rehabilitation treatment facility, which is what we're most known for when people hear of Yellowstone Boys and Girls Ranch. That's our inpatient facility that's in Billings on our ranch. And that's where kiddos are going to go to get that higher level of care that they may need, where they would be staying on our ranch for an extended period of time, as opposed to us providing those services within their home community. So that's our residential 24/7 treatment. We have an equine center and a recreation center that's there as well. So kind of where we're located, again, folks often just think that we're in Billings, and these are actually everywhere that we're at currently. And then we just continue to expand and kind of bleed out from our main hubs. So we're in the Billings and surrounding areas. Our Livingston hub covers Park, Sweetgrass, and Gallatin County. We have some folks in Harleton. We have a hub in Lewistown. We're providing and growing into the Great Falls and surrounding areas. Up in the High Line, so Harlem, Chinook, and Havre up by the Canadian border. Butte, Dillon, Missoula, and the surrounding areas, as well as Kalispell. So we're pretty much everywhere in those main hubs west of Billings at this point. Not quite in Helena right now. That would be the one that we're not currently kind of have services up and going out of those kind of main cities. So our school-based services, which is CSET or our comprehensive school and community treatment. So those are located in our contracted schools throughout Montana. So we're not in every single school. It's kind of just those schools that have identified the need and reached out to us. Those services are provided in the school during the day with kiddos. Kids are often referred by the school district. They've kind of identified, hey, this kid may need some additional support. And we have teams that work within the school that are YBGR employees, but are housed within that school environment. And they're providing therapy services as well as behavioral interventions. When we have a school-based team, usually it's a licensed or a candidate's licensed therapist that's working in that school, as well as a behavior specialist. So they're providing group therapy, individual therapy, family therapy, as well as providing some of those just everyday interventions if a kid might need some extra support at lunchtime or during recess or during a specific class. Those folks can kind of sit in and provide those interventions and supports in a more one-on-one way that the school might not be able to offer or have outside of a kid's maybe 504 plan or IEP. They can kind of support in that way. Our school-based services are also year-round. So just because it's considered school-based doesn't mean that they end during the summer periods or during breaks. So during that time, that's when our school-based teams would be doing activities and meeting with the kids and families kind of outside of that school environment. A lot of what they're doing during the summer is kind of doing groups and doing activities with the kids where they can kind of actually have more time with the kids because they're not constrained to the kind of pulling kids out from class or during lunch or recess. So that's a little bit about our school-based services. The next would be our targeted case management. So our targeted case managers are kind of the person that is the go-to for anything that you would need with services. So they are really kind of there to help connect those families and that kiddo to whatever supports they may need. So if a family comes in and they say, hey, I need therapy or I need this support, I, need some advocacy and support with the school or with this area, that's kind of where the case manager can kind of come in and pick up some of that stuff and help find those resources and connect those families to that. So really they're kind of like the overarching person in a kid's services that they might have with YBGR, and kind of if we have any other services that the kids are in, they would kind of work in tandem with all of those services to make sure everything is kind of running as smoothly as possible and all of the kids and families' needs are being met. Our therapeutic youth mentors work one-on-one with kids. They work with them at least for 4 hours per week. So they can kind of break that up into however works best for that kid and family's schedule, or they could do a big chunk and like take them for a 4 hours, 5 hours on a Saturday and kind of hang out with them. And they're really just kind of working with them with any kind of behavioral interventions that they might do or need, and providing some structured activity, as well as just kind of that one-on-one mentor and trusted adult to kind of work with them. Our next one would be our home support services. So this is another service that kind of works as a team. There's a therapist component as well as a specialist component that works with the family. And this provides some in-home services that focus on strengthening the family development, parenting skills, and supporting the youth to maintain in that home setting. So a lot of what can happen is they would provide some like it says, parenting skills, or even some education on how to best kind of work with your kiddo that may be presenting some mental health or behavioral intervention needs. And then that specialist and therapist would be working with the child on developing some coping and self-regulation skills. So it's kind of a dual thing where the parents, you get some individualized support as well as the child, and then we kind of come together with that whole family unit to make sure everybody's kind of meshing and working towards those goals. Our chemical dependency program, like I said, is contracted in certain counties right now throughout Montana. And in our outpatient, our community-based side of things, those services are mainly being provided within a school setting. So we're in a few of the schools in Billings. We're contracted for Park County, Blaine County, and Fergus County, I think, right now. So we can provide those services via telehealth if the person is, we don't have a licensed addiction counselor in that area, or if we're in one of those schools, they're providing some individualized chemical dependency therapy, as well as they can provide family therapy. And then we are also doing some prevention services with kiddos that might not need the level of intensity of doing that individualized therapy yet, but they might just need some education and support in the prevention side of things. Our employment support services, which is called IPS, is provided in Yellowstone County only because that's a grant funded program that we have. And it really works with the kiddos one-on-one to help them find employment and work on the skills that would be needed to kind of obtain and maintain employment. So that is a program that works with kiddos 15 to 24. And kiddos do not have to be enrolled in any other service with YBGR to participate in that program. The only thing that they have to have is a clinical assessment and be willing to work, and they can work within that program. So most of our services that we provide, we work with birth to 18 years old. As long as the kiddo is still in school, we can work with them until they're 18. But IPS goes past that to 24 years old. So even if you have a kiddo that might not be in our services or is older than that 18 range, they could participate in this program. So they're working with those kids and young adults on how do I interview? What type of clothes should I wear to an interview? And then once they would get the job, okay, well, this came up. Now I have an issue with my scheduling. How do I go and talk to my boss about that? Or I have a conflict with a coworker. How would I work through this? So they're paired up with an employment specialist that kind of walks alongside them in all of those different areas to support them in that sense. Our Title 4B program, or it's called Child Welfare Prevention and Support, is a program that is working with visit coaching, supervised visits, and general monitoring. So it's most often we're working contracted with the state of Montana and usually CPS with those cases, but we also do private pay as well in this program. And that's working with parents that might be working to be reunified with their kiddos and may have CPS that has asked them to have supervised visitation or take a parenting class. So we have lots of different options and different classes that we can provide under that. The most often ones are the ones that are listed. So visit coach is working with that parent, and there's a unification specialist that would sit and supervise the visits and then would kind of debrief with that parent about, here's kind of what I saw. Maybe you could try this with your kiddo and provide some coaching. With the supervised visits and the general monitoring, it's a little bit more hands-off, where it is just kind of monitoring and just making sure everything is going well and providing feedback as needed. And then we have some other classes that are more specialized into different parenting skills that we also offer under that program. So this is a little bit about our funding and access to our services. So all CBS programs accept Montana Medicaid. We also accept private pay in lieu of insurance. So then it gets kind of specific. Our school-based and chemical dependency and some of the psych testing that we can offer take most funding sources. Case management is a Medicaid only program. So that's the one that has maybe the most stringent kind of restrictions on what we can take for funding with that. Our youth mentor accepts Medicaid and HMK extended. Our home support services accepts Medicaid, HMK, extended, and private. And like I said, our Title 4B is a child welfare driven or private pay service that we can offer. And then a little bit about our residential services. We have a 410-acre residential campus that is located in Billings, Montana. It is a actual ranch where there are animals and the kids get to participate in some of those activities. We have different lodges that serve both boys and girls, and they're separated by that. They have a recreational center that they use that they can engage in athletic activities. We have an equestrian center where we're doing equine therapy with the horses with kiddos. And there's tons of other extracurricular activities. They raise pheasants, they have a garden, there's a woodworking shop. They have tons of opportunities for extracurricular activities. And then those kiddos would be attending our Yellowstone Academy, which is that school that is located on our physical ranch. And then a little bit about just how, if you would be interested in services, how to get connected. You can email that email. That's our number to call to admissions. And then I've got my contact information on here. And I've sent all of this to Beth, and she can share this presentation as well as some additional, more in-depth information about some of the programs as well. So that's kind of my little blurbs about things. I'll stop sharing and then I will open it up to questions if anybody has any.
Thank you. Anybody have questions?
Hi, this is Matt Furlong. I live in Helena. I just wanted to thank you for the work you guys all do. YBGR doesn't reach out in Helena as far as I know, but I mean, maybe through telehealth and that, but we just always find that YBGR is one of the best referrals we can give when a kid or a family's in the Billings and surrounding areas. So I just want to thank you for your
Thank you.
focus on families and the support to balance, you know, the need for support versus the challenges that might get in the way of parenting. So thank you for that.
Thank you for that feedback as well. And actually, one thing that I did forget to mention that wasn't on my slides that I forgot to add in there is our outpatient therapy resources as well. So we do have clinicians that are providing therapy throughout the state of Montana in person as well as telehealth. It kind of is focused on where that family and kid would be located and if we have an in-person therapist there. But they can provide individual, group, as well as family therapy to those kids and families. So that was one thing that I had forgot to put into my slides. And then I did see a question about if we serve over towards Kalispell. We do. So in Kalispell, we are currently providing our home support services, our outpatient therapy services, that Title IV-B programming with the parenting classes and supervised visitation. And then I think they are just starting up some therapeutic youth mentoring up there as well. So we do have the majority of our services up there. We are in a couple of the schools in that area as well. I think we're in the Kyla school and the other one's gonna not come to my brain right now, but we're in like 2 schools up there with some school-based staff. So we do serve Kalispell as well as those surrounding areas. So we wouldn't have any school-based staff that would be working like as a school-based staff technically if the kiddo was homeschooled. But with that, the school-based services, our CSCT, the kind of sister program to that would be the same would maybe be our home support services. It's kind of very similar where our school-based programs have that therapist component and a specialist component, and that would kind of be what our home support could provide outside of a kid being enrolled in one of the schools that we are currently providing the school-based services. So kind of still working on that same stuff, working with the kiddos on self-regulation, coping skills, working towards those behavioral interventions, as well as that therapist kind of working with the kiddo. They can do therapy with the kids, and they're there kind of to provide that support and guidance to the parent if needed.
I have a question. Do you know which school specifically here in Billings your chemical dependency program is in, possibly?
Goodness.
If not, that's okay.
I don't know it off the top of my head, but I can definitely get where they are. I don't supervise those 2, so I don't know them as specifically because I know they also bounce between a couple of different schools, so I don't want to speak out of turn without knowing which ones they are covering. But I will
Sure.
make a note to get where the school-based chemical dependency is at, and I can shoot that over to you in an email, and you can maybe give that to the Billings folks.
Sure, that would be great. Thank you. So the chemical dependency program, does it look a lot like the other like CSCT those sort of things where it provides specific therapy.
Yes, yep. So we can provide, like I said, with that prevention and then the actual chemical dependency. There's a slight difference in that to be in the chemical dependency side of that, a kiddo has to be diagnosed with a substance use disorder. So that would be kiddos that maybe are a little bit heavier on the side of needing the intervention as opposed to a kid that might not be in like active use. So we can kind of work with kiddos wherever they're at in that journey with that. But yes, it would provide if they had been diagnosed and were in the chemical dependency and not the prevention side, they would be able to provide that individual, family, group therapy, whatever that kiddo might need and the intervention that would best fit for them.
So kind of going with that, you talked about that they do need to be diagnosed. For your other programs, do the kids have to have a diagnosis?
Yeah, I can kind of speak to what that admissions process would kind of look like if folks were interested in seeking our services. So if you would reach out to our admissions or if you reach out to me or however of those options that you decided to do, the first thing that we would do is set up a clinical assessment with our admissions team, and they would do that assessment. To be eligible for our services within YBGR, a kiddo does have to be diagnosed with, it's called an SED diagnosis. It's serious emotional disturbance, which sounds more extreme than what it is, but it's most diagnosis that a kid would be diagnosed with would fall under that. So ODD, ADHD, depression, anxiety, pretty much most of the normal ones that we might see a kiddo with nowadays would qualify for our services.
Thanks. Feel free to unmute or turn on your screen if you have any questions. Kind of going back to the CSCT thing, I'm not super familiar with its history. I have worked with a couple families within the schools that have had those services. And I know that their funding is kind of a big reason why some of the schools don't have it anymore. How are the schools funding those programs, the ones that have CSCT?
Yeah, so there's some like logistical things with like contracts, and they cover part of the portion the schools do, as well as then the reimbursement rates that we get through Medicaid. But there have been some closures with other different programs and other service providers who have offered that in the past. One of the major ones that had a lot of contracts within the school closed a couple of years ago, and actually YBGR did pick up a lot of those contracts to continue those services within those areas. That's where we've seen a lot of growth within the Butte school systems. We are in pretty much the majority of the schools in Butte, as well as we have some in those outlying areas that had those services. And we're looking to continue them, but looked for another provider since the other one was no longer providing those services. So just like with most mental and behavioral health stuff, and Medicaid funded services, we're kind of working with the state on those things. And that's kind of the ever fighting battle that we're fighting, is kind of working to continue to get the funding and the resources for those programs.
And CSCT isn't in high schools, is it?
It is, yep. So
Oh, it
we can
is.
work in any schools. I've got my youngest kiddo that my team is working with. One of my teams is a 4-year-old. And then I have folks that are working in high schools, and they'll work with those kiddos up until they're graduating from high school.
So if family has a child that goes to a school that is not a part of the CSCT program, they would maybe access your services at home or through like more community based.
Yes, yep, that would be where, if we're not contracted in that specific school, I would say again that HSS, that home support, is kind of that sister program where really we're working towards the same goals in those programs. One is just more in the community as opposed to in the school setting. So I would say if folks are interested in having those services, but we might not be contracted or have a team in that specific kiddo's school, reach out and maybe we can look at some of the additional services to fit the needs.
Thanks.
I have a question.
Yes.
So I have a son and a daughter that have now graduated, and they're both on their own. But when they were in middle school, high school, they were both in the CSCT programs there. During that time, I sat in on a Office of Public Instruction Project Aware grant, and they did a white paper on our family to just kind of go through like how were the services, like what recommendations could come out of that. One of the biggest challenges was when the CSCT program came to the schools, they were, and I think they still are, a separate entity. So the school kind of like rents space and they are there working with the mental health services or behavioral health services, but they're not really integrated with the school counselor and other, I guess, the school as a whole. I mean, I think there is a connection, but it's not like a united connection because they're two separate entities. But at the time, they were really struggling to give a space to the CSCT program that was, I guess, like thoughtful of what would be an appropriate environment for a child. And they were putting them in janitor rooms and different places. Like, well, what do we have left over? Give them that last resort room that we won't use. And I just wonder, because we had a long conversation and they were going to work on that. And the Project Aware only covers 3 schools or 3 communities at a time. And they've done that for, I think, 3 different years now. I was part of it on the first year and got to do site visits and things. So it was neat. I was the parent representative on that. And since I kind of strayed away from it since my kids graduated, I've kind of got back involved now. So I can, as a family peer member, try to have more input. But I haven't heard how the CSCT setting is looking in the schools. Can you speak to that at all? Or are they like being brought in and treated with respect in that? Or, I mean, how do the staff and the kids feel about the environment that the school's offering?
Yeah. You are correct. When we are contracted with a school, we are contracted in there. So we're not fully integrated. Our staff, our YBGR staff, and not school staff. So to some extent, we are kind of a visitor in those schools. I will say each and every school has its own culture, as well as, the administration in each school. So I can speak to maybe the schools that I oversee, and we are very much welcome in there and working in tandem with those counselors and with those folks. One of the things that we do in the CSCT program is we're meeting at least quarterly with those administrators and kind of talking about what are the needs, how can we best support, and that's where, like in my role as an administrative supervisor, as well as I have a teammate who is the regional clinical manager, we kind of work in tandem to supervise our staff, would be going in, and if there were any issues like that, which it seems like that's unfortunate that they were putting them in a non-therapeutic kind of room to provide those services. Thank goodness we're not dealing with any of that in the schools that I'm supervising. My staff that I have in our Vaughn school has an entire kind of side of a building, and it's a space where they can take kids out of the main building, and they have their own little space where they can do things, and it really is a setting where the kids feel safe. As well as have staff in the Harlem school up by the Canadian border in the High Line, and my chemical dependency counselor, as well as my therapist that I have there, each have their own specific office with the door that they can shut. So it is a private and therapeutic space that those kids are receiving their services in. And we're actually, YBGR donated a building to the Harlem school so that it can be its own like therapeutic kind of building again. So it's kind of that separate entity where kids can feel like they don't have to walk through the school where other kids are kind of seeing them and they're like, oh, you're going to see that person. So we are always cognizant and trying to find ways to make sure that the kids and families that are seeking our services feel comfortable with then going into that physical space as well. Hopefully that answered your question.
Yeah, that's great. That sounds excellent.
I know when our daughter was in high school, they had brought in some organization to do some social supports there. And they were literally like in the old supply closet in the counselor's office. And you'd sit there and you're pretty much like sitting against the wall, facing a wall. And yeah, she was very apologetic and I mean, did her job very well. But yeah, I've seen them just kind of just run out of spots and yeah.
Yeah, and that's something that we're always having a conversation with schools when they express interest in having our school-based staff there is like, do you have the space for us? Where can we, you know, we have to be able to appropriately provide our services in the way that we should be. Otherwise, I think it hinders the success of a program if the kids and families don't feel comfortable in coming into that setting, because we are working with kids on sometimes some heavy things, sometimes not so heavy things, but physical space is a huge part of that. So
maybe as they build schools, we can advocate for behavioral health parts, centers, rooms.
yes.
Yeah, because I've seen the environment be a trigger for kids, so they they go in and because they feel sometimes like they have to, but they just the anxiety in that, and then the kids passing by, seeing them in the room where kids struggle, and then and even if that's not what the population thinks, that's what the kid who's in there often thinks, and so it's a trigger, and then they leave with that, and then all of a sudden it's a rupture right out of the door. That's yeah, I think we're learning. This was when CSET first kind of rolled out. First probably 5 or 6 years of CSET.
Mhm.
I have a question, a
Yeah.
situational question, I guess. Well, first, what is CSCT? Because I missed the beginning, so I don't know if I missed like 7 minutes of your presentation.
No worries. It's a comprehensive school and community treatment.
Okay.
So it's mainly kind of folks that are working within the school setting. But with that, it can kind of be school, home, and community. That's where all of our services can be provided. But that one, there are staff physically in the schools working with the kiddos.
Okay. So then our situation is a little interesting. I'm gonna meet with the school and see if maybe we can get an IEP under homebound. Because when I first met with them for an IEP, I didn't know that was an option, and so I said homeschool, and apparently terminology is really important. So if we got an IEP and they deemed him homebound attached to the school system, then would he be served under the school system, or would it be a home-based service? Like, what part of that would we look
Yeah.
at?
I think it could potentially be either, because if we were contracted in that school and kiddos still enrolled in that school, then like I said, our school-based services can be provided in the home, community, or school. They don't have to provide those interventions and that therapy in the actual physical building of the school. There is some flexibility in that. Otherwise, we could look at that more traditional home support service that would be providing those kind of same interventions and services, but it wouldn't be attached to the school, in case, I don't know if anything would ever happen that kiddo wouldn't be with that school, or maybe he graduates out into the next level of school. I don't know how old your kiddo might be. But that would be something that I would maybe think of too, is sometimes a kid might go from one CSCT or school-based team to another if they're going from elementary to middle school or middle school to high school. So there might be more longevity depending on the situation if we went with a different program that wasn't tied to.
Yeah, he's 9.5, but we're in 3rd grade work right now. I don't know. I'll have to look more into your program and see how that would, if that would serve him and help. Because I've never actually heard of it.
Yeah, most definitely. And like I said, all my contact information will be sent on those slides and everything, as well as the contact for our admissions. So if you want to chat through it with me or speak to somebody admissions, we would all be happy to kind of chat through if you have any other questions as you dig into things.
Thank you.
Yeah.
We have a question in the chat about, is CSCT part of the Delta programs?
And I am
And
not
I didn't.
familiar with the Delta programs, so maybe if I had some context on that, but being that I'm not familiar with it, I would probably say we're not. So it's probably a separate program.
I think. So my experience is that when my child was in high school, they were in the Delta program, which is, in my understanding, a special education track, but for emotional disturbances, mental illness versus maybe developmental disabilities, cognitive, that kind of thing. And so I do think they're two separate programs. I think kids that are in the Delta program obviously should have CSCT. But yeah, that's my understanding of how
Yeah.
it is.
So it seems like we would be separate programs, and to your point, yes, it seems like that might be a nice thing to be in tandem with. I know we're recently moving into the Havre School District and getting contracts for CSCT up there. And one thing that we've been doing is kind of really being in communication with the special education director as well as the school psychologist of that district, because they've seen the need with the population in their schools, and kind of just being like, hey, this kid may need some additional support. Can we get some services up and running within the community and the school? So we do work very closely with those partners within the districts.
I would say that I had a family that I worked with in middle school, and they had a CSCT program. And the one thing that was really great about it versus maybe the special ed is that it did involve the whole family. It could be taken into the home. It continued after school was out, because a lot of times the kids will have that support in the school, but then when they go home or the family is at home, they don't really have any of those supports to kind of continue after school. So it was
Yes, and
super helpful.
that is why we don't discontinue our services either throughout breaks or during this summer as well, because just because the school is out doesn't mean that kids don't need that support, and to go without it for several months and then try to pick back up can be a really heavy burden for a kiddo, especially when they're making progress, and have that support to kind of not have it is detrimental at times.
Yeah, that's kind of why I was asking, because I I know at my son's school, the life skills classroom used to be at that school. And then right when he started kindergarten, it became the Delta program. And through the years, obviously, like, the kids have an understanding that those are the kids that have, they're the scary kids, or like the behavioral challenges. And my my oldest is well aware of. My youngest has autism, pretty severe. He's nonverbal. And so I think he's learned that they're not, like the scary kids. They have other challenges or issues that they're facing. And so, and I know those programs move throughout the school district too. They move them to different schools like they do the teachers. And so I was just more curious because, yeah, like Beth said, I think that's always a worry or a fear of mine, working with families / being an advocate, um, and raising awareness as a mom. I think that a lot of parents that I work with don't know how to incorporate or how to use the tools that they're using at school, because I think they're told all these big fancy words in IEP meetings, but I don't think that they necessarily know how to apply them in their everyday life. And so, yeah, I guess I was just kind of curious if it was like something that we could bring up in the like subcommittee BOC meetings that we're in, just as like if that could be incorporated with those, for them to have a contact, or, I don't know. I was just more, my mind just kind of does that, where it starts spinning and thinking of all the ways, yeah, to make
Yeah.
the things that are already being utilized maybe just a little bit better, or a little bit more substantial, I don't know, in these kids' lives, instead of it just being, yeah, because like the issues that they're facing and the challenges, they're not going to go away. And so ensuring that they are being utilized properly so that they can, be effective members in society like later on, and set them up for success instead of just, putting patches on. I don't, yeah. Sorry.
Yeah. No, it's a great point. And the more that we can integrate all of our programs kind of within all of the different settings of a kid and family's lives, the more successful that we can be. Because usually if behavioral or mental health is presenting in one, it's usually presenting in another environment. And even if we don't have a school-based team, I know you had brought up like IEPs and things like that, our other services can provide support and advocacy through some of those different meetings that a family might be having. Our case managers work with people who are looking for support with like SSI or IEPs or different things. They can provide support in that way. I know as an outpatient therapist, I've attended IEP meetings for kiddos that I've been working with to kind of speak to that need from that way, if at all possible. So even if we're not providing school-based services and don't have a team, all of our other services can provide support and advocacy within that setting and realm.
Okay. And you guys do have Medicaid reimbursement for that program?
Yeah, so all of
Okay.
our programs are funded through Medicaid. Some of them are a little bit more stringent in what specific they do. Like our case management doesn't take like CHIP or extended or things like that. It does have to be full Medicaid. But most of our other ones are a little bit more flexible, as well as any type of private pay. We can work with families if they need kind of support on that.
Okay.
So
We
yeah.
just Beth and I work at the children's clinic, and they are incorporating a new behavioral health team, and it's going to be incredible. It's just on the ground level right now, trying to get it kind of the momentum of it going. And so also kind of curious if there's, because there's a lot of cases that we've heard that, they're doing well at school, but then when they get home, that's when the behaviors start, or vice versa. And so even just if there wasn't necessarily yeah, maybe just more like teaching the parents and the kids how to um, work together, at home, that might be a good referral. So would that need to come from their PCP or from the psychiatrist, or?
For our services, anybody
Yeah.
can refer. So I would say
Okay.
if there's a provider working with that family, we always, encourage that referral be done in tandem with the family and that they know that they're being referred to us.
Okay.
Or the parents can refer themselves. It really doesn't have to be a referral through anybody specific. And I did
Okay.
not send our referral form to you, Beth, but I can send that along as well. And then
That would
if
be awesome.
it's kind of just like some basic information, and then there is like a checklist of just maybe some behaviors or concerns that parents or that provider, whoever's referring, might be seeing. And then that kind of gives us kind of our jumping point to do that admissions assessment and kind of get those kiddos involved in services. But maybe like a service that you would be speaking to kind of provide that support to the kid and family and parenting skills and working with the kids that may be presenting with mental or behavioral challenges, like our home support services would be the specific one that's the exact thing that it's
Yeah.
hoping to do with those parents. And then we have, other services like mentoring, if that kiddo needs kind of that one-on-one support and just have some additional time with a trusted adult outside of their family, we provide that. Our case management's kind of that overarching, that a family just may need some additional support and advocacy, and like, hey, I need some supports, but I just don't know how or where or
Yeah.
how to get connected. They can
Yeah.
kind of help them that way. So we can
Okay.
do a few services, all services. Like there's not really any like specific thing. The only one that would come into play is with our mentoring their the state of Montana, and how that works is they have to have another core service. So if they were doing mentoring, we would just have to have another one of our services kind of in place.
Okay. Okay. And then you said you're going to send out a list to Beth of the schools that you guys are incorporated in as well.
I can get a full list of our
Okay.
CSCT schools as
That
well.
would be awesome. Thank you. Thank
I
you
can
for
send you
answering all of
some.
listening to my long-winded story, and also answering all my questions. And I also agree with what Matt said. You guys, the more I learn about all the services that you guys provide, it's just, you know, it's great to have a place, I think, you know, so close to Beth and I where we can send those referrals because I enjoy hearing your guys's holistic approaches to these, you know, behavior challenges. And yeah, I've only heard great things about what you guys do. And so I wanted to also say thank you.
Thank you. Any
Anybody
other
else have any?
questions?
Right, if there aren't any others, I will send out all of that information resources slides to everyone that was on this webinar today. And again, you know, Yellowstone Boys and Girls Ranch, especially Alexis, has been more than what am I thinking? Informational, easy to get a hold of, very responsive. So if anybody has any further questions, I'm sure that she would be happy to answer them. Again, next month we have Chinook horses, I believe. It looks like Matt Furlong put in files, maybe for county. I'm not sure. So if you guys are interested in that, click on that link. Hi, Matt.
Yeah, that's we're having a mental health block party in Lewis and Clark County.
Nice.
It's on Rodney Street. I know our group's kind of spread out in that, but if anybody's knows somebody or whatever, it's we're focusing on families, and we've done this several years. But we have a lot of fun things for kids that's unique. So it's kind of like a health fair, but we incorporate sensory things. So it's kind of like, you know, the fair or the thing that you were at last this weekend, Beth, but it's also got like more games and there's free food at it. I'll be the cook for the food, and I brought in some sensory things too, pinwheels and some stickers that are like sensory sort of support for, you know, kids put them on their desk and stuff, and they've got little bumpies in their pictures, and some of them has a guided breathing exercise on them. And so anyways, I brought some fun. I'm bringing some fun stuff for that too. And yeah, if you know somebody or you want to make an extra trip, that'd be fun.
Yeah, if anyone's in Helena or the Helena area, absolutely. It sounds good anytime. Yeah, we can incorporate the kids and the families. I think that's great. So thank you for sharing. I think that's all the info I had to go over. Like I said, next month is Chinook Horses, an equine therapy program. And again, like I said, if you want a lot of this information, or if you want to stay up to date with things, becoming a family member is probably the best way to do that. And like, again, it is free. Yeah, I guess that's all. Thank you, Alexis, for being here with us and all the great programs and the services that you guys are doing.
Yes, thank you for having me. And if anybody has any questions, please feel free to reach out.
Okay. All right, guys. Thanks. Have a good day.